Hi, welcome everybody. Here we're going to talk about what instruments and supplies you need for our mini residency hands-on exercises, and a lot of these supplies and instruments you're going to be able to use for patient treatment as well in your practices. So when you are in our website, you can go to the mini residency tab, and this contains all of the videos for the mini residency. This is where you can enroll in the mini residency program. Here's our flyer where you can click on the flyer, and it gives you a detailed description what we cover in each of the modules of the mini residency. And the two of the modules that you're going to need the instruments specifically are the 303 Live, 303L, which is basically your team training and hands-on practice. This is a live class. And then we have another one, which is 309L, 309 Live class. So these are hands-on live classes, but you're also going to be practicing on your Typodont with the different instruments throughout the different modules, starting from 301. And you're going to have Typodont exercises and bracketing and bending at home that you can practice in your home. And then we're going to be practicing it in a live class as well, but you'll have video instructions how to put brackets on a Typodont, how to band size. So you can practice that at home as well. So you would need certain instruments for the hands-on practice, because of course orthodontics is not a theory. We teach a lot of theory, so you can understand orthodontics, and you can treatment plan and diagnose cases, and you can have amazing results. But it's very important. So it's very important to learn the theory, but orthodontics is very much a hands-on practice, which actually makes it very exciting and fun. So you're going to need certain supplies and instruments for that. Okay, so for that we actually have an instrument list. So if you go to our website and you scroll down to you hover over the online mini residency tab, you can see here the flyer, you can see the textbook requirement, and right here student instruments and supply list. So if you click on that, it's going to give you all the required instruments, and it's going to give you some suggested instruments too. So I'm going to go through this just quickly, and you can kind of study this page in more details. But there's certain instruments you're going to need for your hands-on practice, which is really starting from 301, the first class, and definitely for the live classes, which is 303L and 309L, like I mentioned, that comes right here. So here's the first live class that we're going to practice how to take pictures, how to bracket Typodonts, how to place bands. And then later on, we're going to have a 309L where we're going to practice, not just the basics, but we're going to practice more advanced hands-on practices and exercises, how to close spaces, how to do some simple and more complex wire bendings, putting on transpalatal arches, removing expanders, seating expanders, face mask, things like that, as well as debanding. We're also going to be covering how to remove braces, and how to make retainers, seat retainers, and things like that. So we have lots and lots of practice and hands-on practices on these live classes. So going back to the instruments list, again, you go to the mini residency tab, and you go to the student instruments and supply list, which gives you this list. Okay, so anything, it says that anything start minimum required instruments and supply for hands-on hands-on Typodont exercises. So anything with a stars and that's bold, it's going to be required for your hands-on class as well as your Typodont practice. So you're going to need intro exam mirrors. Now I provided some links here, so you can click on some of these links, and then it's going to take you to some of these websites where you can actually look at what I'm talking about. So for example, PhotoMed sells a lot of intro mirrors, and here are some examples. You don't have to buy from these companies, you can buy from any companies, but these actually just kind of gives you some ideas what kind of instruments you need. You're going to need intro mirrors, you're going to need ligature directors, and I'll give you some of my favorite ones, and then, like I said, you can work with any suppliers that you like to. This is my all-time favorite ligature director and band pusher, and this is the company that sells it, but you don't have to buy it there, but it kind of gives you an idea what it looks like. So method pliers, and then we have instrument reviews throughout the mini residency. So as you're going through your courses, you're going to see the examples. So I really like these methods. There are different ones. This is the one that kind of comes together. It just has one of these little springs. The one that has two springs sometimes doesn't work as well. And I describe this in a mini residency. So as you take the courses, you're going to get a description what instruments I like, okay, and what instruments most orthodontists likes as well, or that works for them. But I give you good suggestions what kind of instruments to buy. And you don't have to buy Hu3D instruments, but I just gave you the links to Hu3D. It's a large company, so everybody's familiar with it. Like I said, you can buy these instruments anywhere you like. So you're going to need method pliers, ligature directors, intraoral mirrors, both pedo and adult. You're going to need heavy and hard wire cutters, pin and ligature cutters, distal end cutters. There's many different distal end cutters, and actually I go in big details about the different distal end cutters that exist in the courses. I think 303 are covered extensively. So you're going to get a lot of details about these instruments, okay? So I summarized all the instruments that you need here, but but don't worry about all these instruments. We're going to get into much details about them, how to use them, how to hold them, how to take care of them, and all those kind of things, okay? So you're going to need a bird beak plier. This is my all-time favorite bird beak plier, and like I said, I put the instruments that I like the most here, and this is the best one, okay? You can buy a bird beak plier for under $100. This happens to be the best one. I love this, and this is something I have used for 20 years. And these instruments will last a long time, but you could just buy a cheap one, okay? So you could just going to be doing some Typodont practice. Just buy a less expensive version of bird beak pliers. Everybody makes bird beak pliers. Any instrument company that makes orthodontic instruments is going to make a bird beak plier. So you can just buy a less expensive one and see how much you like it or use it. This is my all-time favorite one. You're going to need a band seater, band pusher. There's a link here. Bite stick. If you see it's stainless steel crowns, you probably already have this. Band remover plier. It's a plier that removes the band, and it looks like that. And then we're gonna need a direct band bracket holder. We do a lot of our bracketing with that we do it directly first, so you learn how to do it, and you can always learn it indirectly later. So I really like these direct band bracket holders. And then let's see, where are we now? Typodont adhesive for brackets. Now this is not for patient treatment, so it's to get the brackets on the Typodont. You can use super glue, you can use a hot glue gun, anything that's going to get those brackets on the Typodont so they don't fall off would work. And then you're going to need a swivel head bracket positioner. A straight one is not good enough. You need the swivel head because it's very hard to get back to the 5s and the 4s. Especially in patient treatments, you can do it in a Typodont with a straight bracket positioner, but in a patient treatment, you will not be able to get back to the 4s and the 5s, and your bracket's going to be falling off, and you're going to put it in the wrong position, and you're going to be repositioning and wasting a bunch of time. Get the swivel head bracket positioner or don't get anything, okay? If you don't have that, you might as well just position them with a perio probe because you will not be able to get back in a patient's mouth with a straight bracket positioner in most of the patients. And then you're going to need bracketing cheek protectors. And again, I put my favorite one there, which is the OptiView. I suggest that you buy a blue one. The white one is the large one, and that doesn't really fit most people. 95% of the patients going to need the small, which is the blue. Again, it's something that we cover in details in the seminars that covers the instruments. So let's see, where were we? Face mask, headgear, that's for class 3s. We're going to learn how to put on a face mask. Of course, that's a big part of our phase 1 treatment. Rhino elastics for the face mask, sea lion elastics for class 2 and class 3s. Tying ligature wires, short and long. Kobe ligature ties. and elastic color bracket or arch wire ties. Those are the little rings that holds in the arch wire, but you also need the steel ligature ties. These are the ligature wires, which is stainless steel. And then you're going to need a transpalatal arch, TPA, to fit the typodont, and depending what typodont you get, you need a transpalatal arch that fits the typodont. So just get the sorted one, and then we can pick it in the hands-on exercise which one fits your typodont the best. It's called TPA, transpalatal arch. It's a prefabricated arch wire that you can fit to your typodont. And then you're going to need a power chain, which is probably the gray one, so it matches the wires and the brackets, but the color doesn't really matter. You're going to need mirrors for photography, occlusal, side mirrors, and then cheek retractors in both adults and pedo. And then you're going to need a few arch wires, and the 12, the 14, 16 by 16 nickel titanium, 18 by 25, 19 by 25 stainless steel, which we use a ton. That's your main mechanics wire. 18 by 18 stainless steel, which we use for utility arch. 19 by 25 keyhole, if you have it. If not, that's okay. We'll usually for the hands-on exercises, I do bring a lot of arch wires. So if you don't have it, you don't have to worry about it. I will have arch wires. 19 by 25 beta, but you will need this for your video at home remote learning exercises. So just some arch wires will be needed for those exercises. Separators, night tie separators and elastic separators. The night ties are nickel titanium, elastics are rubbery. I only use nickel titanium spring separators. And then you're going to need night tie closing coils, 12 and 12 and 9 millimeters, and then open coils, stainless steel, and closed coils, stainless steel. And then you're going to need typodont for bracketing. Now, you can get any typodont you want. You don't have to get the Columbia typodont. You can if you want. This is what we used to give to our live seminar students. This is not cheap. This is $100-something, I think. You can get typodonts for a lot less. Okay, you may actually have one from dental school. Just make sure it has all the teeth. Okay, so you can just get on Amazon and see if you can find a typodont there. You know, there's a Kilgore typodont, and I have seen typodonts for as little as $50 on some of these Amazon-like websites or eBay. So sometimes you can get these typodonts for much cheaper than you can get it in retail. So any typodont will work. Now, some suppliers will sell you typodonts and bands that fit the typodont because each typodont has different size teeth, okay? So if you go with one supplier that's going to sell you all these instruments, it might be easier, and you can check with them because they can pick the bands for those typodonts because you're going to need bands, okay? So look here. Here's bands for the typodonts. You're going to need bands for the sixes with buccal tubes, and the upper sixes with TPA or gauche ligature lingual sheets with distal hooks to tie in a TPA wire. Anybody who knows about orthodontics, they will understand this. So any company that sells instruments, if you give them this sentence, they will understand it, okay? And you will understand this as soon as you go through some of these courses, okay? So you're going to need bands on all the sixes, buccal tubes, and on the upper sixes only, TPA or gauche. In Europe, they call it gauche. In the US, they call it TPAs. We have doctors taking our courses from about 25 to 30 countries, so I have to use different language because in some places they use the same thing with different names. In the US, we call it TPA, transpalatal arch. In Europe, they call it a gauche. Lingual sheet with distal hooks for TPA tie-in. Like I said, any lab or any instrument company that's experienced and sell orthodontic instruments, they will understand this immediately. So that's all you have to do is just give them this list and they should know. Band cement, 3M Rely Extruding Cement is one of the best cements, and you can use this for cementing porcelain fused to metal crowns. You can use it for stainless steel crowns, and this is a great metal cement, and it really is great for cementing bands, and it's an easy cleanup. And you're going to need metal twin brackets for typodonts. Any bracket is fine. Don't buy expensive brackets. I put some links here for what I use. I use the AO brackets. I use 3M Victory brackets, but you don't have to buy these. Just buy any inexpensive twin brackets with hooks only on the threes, okay? American Orthodontic sells twin brackets, and I gave you the list. It's called the Masters and BT brackets, and that you can use that for patient treatment, not just for Typodont exercises. These are great brackets, and they're inexpensive. But you can use any twin brackets that are metal and have hooks on the trees only. And then we use Dolphin software for teaching. You do not need to buy the entire Dolphin suite. That's what's so nice about Dolphin. You can just buy certain modules. It's inexpensive. The only thing you need is Dolphin image, Dolphin self-tracing, and model analysis. That's all you need to do all of our exercises. Okay. If you like to import your 3D models, digital models, then you can get the 3D model, digital 3D model module for Dolphin, and then you can import your STL files, and then all of your models will be in Dolphin. Okay. So you only need to do that if you want to import your 3D models. So basically, you can get by just by having Dolphin image and having Dolphin self-tracing and model analysis. If you talk to the Dolphin rep, they will know exactly what you need, but you don't need to buy the whole Dolphin suite, because you already have a practice management software probably. If you're an orthodontist and you're taking a program, then you look into the Dolphin suite, because it's going to give you the patient management portion of it too. If you're a general dentist or pedodontist, then you probably already have a practice management software, and then you only need a Dolphin image and you need the self-tracing for Dolphin. If you're an orthodontist, then you're looking to the full Dolphin suite, and I can help you with both of those. That's really all you need for the Typodont required instruments. Now, for some of the patient treatment part of it and some of the later on seminars, you're going to need the expander turnkey, and I'll have many of those. That's just a key that comes with the expander. When the lab fabricates an expander for you, rapid palatal expander, they're going to give you one, so you don't have to buy it separately. Just call up your lab and they'll send you one. Light wire plier, here's one from Hugh Freedy. It's similar to the bird beak 3-prong plier. That's to activate the keyhole. Weingart plier, we use that a lot. Hollow chop plier, offset Hall plier. I don't use this very much. If there's a plier that you don't want to get, this would be a good one. But this is a very good one to place a TPA into the lingual sheet. Arch forming plier. That's actually, you need that for fabricating a transpalatal arch. So that's your lingual arch forming plier. That's a really great plier for making a TPA. And molar tube holder, that's to place the molar tubes if you're not banding the molars. And that's really all the instruments that you need for our hands-on exercises. Okay, so I wanted to do a quick rundown for all the things that you may need for the hands-on practice, for the virtual learning at home, where you're just studying at home and you're following your videos. And these are instruments that you will also need for the hands-on practice, and these are the instruments that you will use for patient treatment as well. None of these instruments are specific for Typodont practice. These are all instruments that you will use for patient treatment. Okay, so these are very useful instruments, and don't think that these instruments are only for Typodont practice. These instruments would be useful for patient treatment, and I use all these instruments for patient treatment for all patients. Okay, so these are going to be your bread and butter basic orthodontic instruments, and I try to keep it very simple, try to keep it to the minimal, and there are some other instruments that you may need later, but this, you can treat probably 90% of the patients just with these instruments. It might be close to 100%. If you just have these instruments that I listed here, you are going to be pretty squared away for most of anything in your practice. A bird beak plier, some orthodontists do all of the wire bending with a bird beak plier, and that's it. Okay, so a lot will also depend on your hand skills. Okay, so good. Any questions or comments or questions, you make sure you send it to us and ask us. Otherwise, it's been a pleasure having you as a student, and we're super excited for you to be successful with your orthodontic journey and discovering what orthodontics can do for your professional growth and your practice. And send us any message if you have any questions. Best wishes, and we'll see you soon. Bye.